someone from chronic homelessness to supportive housing and the protections that help keep them housed. I would like to tell you that Commissioner Hardesty is out. However, Matt McNally, the Commissioner's Community Outreach Coordinator, is in attendance. In case you don't know already, we have wonderful coffee and pastries out there, and the bathrooms are straight down the hall. If you have access needs, please do not hesitate to ask the information table. Y también, si necesitan interpretación, tenemos acceso a eso. Pueden buscar sus aparatos ahí afuera y pueden escuchar en español. Before we start, it is my pleasure to invite the Community Relations Manager of Portland Community College, Abe Proctor, to welcome us.
Good morning. Mr. Mayor, members of the council, members of the community, on behalf of my boss, Campus President Dr. Katrina Holland, welcome to the Cascade campus of Portland Community College. I know you have a lot on your plate this morning, so I'll be brief. But just to provide a little context, housing and homelessness are issues that come home to us every day here at PCC. According to a survey conducted in 2018 by the nonprofit Hope for College, some 14% of college students reported being homeless during the past year. And if you expand that question to issues of housing insecurity, that number rises to 55%. So needless to say, when you're homeless or when your home situation is at risk, it's that much more difficult to succeed in the classroom. So I'd like you to consider two things today during this conversation. First, in light of the statistics that I just mentioned, working to reduce homelessness means that we are simultaneously working to strengthen education. And second, I hope the fact that so many of our students show up to class every day, even though they don't have a home, can finally help dispel the myth that homelessness is the result of laziness or the result of a moral failing. Our students are working to better their lives every day, and I think the community and the city owes them our support. Thank you.
Next, Mayor Wheeler would like to say a few words.
Well, first of all, I appreciate the environmental ethos, particularly economizing on furniture. I think that's been a good move this morning. Second of all, I want to thank all of you. It is a nice, beautiful spring day in Portland, Oregon, and I'm sure there are many, many things people could think of doing on a Saturday morning other than coming to a budget workshop. That being said, it's important for us to hold these budget sessions at different times of the day so that people with different schedules and different life experiences have the opportunity to attend. This is, I believe, the second of 3 sessions that we'll be having as a city council. The work that we do here is extremely important. The main objective that we're trying to get out of this as individual city councilors, or in my case as mayor, is to really understand what's important to the community. What do you want us to know as we go about the process of trying to balance this budget? What kinds of things do you want us to prioritize? What kinds of things do you want us to deprioritize? And that sense of where you're coming from really helps us to be able to make the important trade-offs that we want to make. So that's really all I want to say this morning. You're going to hear more about the budget from people who are actually experts on the budget, like our budget people. And you're going to have a panel that's going to give us a little bit of context on the issues around housing and homelessness. And I just want to thank you all for being here and showing your support for the community just by being present. Thanks a lot.
So a little bit of overview about what we'll be doing this morning. We're going to begin with an introduction from the Budget Director, Jessica Kennard. After that, we'll have a housing presentation by Shannon Callahan and Patricia Rojas. After that, There will be about 25 minutes for invited testimony on the topic of chronic homelessness to permanent supportive housing. After that, there will be time for reserved testimony by lottery tickets, and if you did not do that and you want to, you put the lottery ticket in the topic that you would like to speak on. And we will have individuals with lived experience in homelessness, and then we'll go to others who may need to go first, and then we'll go to the larger group. That will be the open public testimony. Well, let me just say this. Before that, let me tell you about the shared agreements, and hopefully we can all agree to these. 2 very simple, direct shared agreements. Everyone has the right to share their views respectfully, and that means in a way that we all understand, and that we'll also be active listeners when somebody is sharing their views. And also, respectfully means staying within the time so that we all have an opportunity to speak, those who want to. The other one is everyone has a right to feel safe, that we're able to talk about things where maybe we don't all agree, we have differing opinions, but we can say that in an environment where we all feel safe.
Madam Moderator?
Yes.
Is this on? I have just a request. This is going to be an abbreviated session. Not everyone's going to get a chance to speak. Some of the most important conversations that are going to go on today are with senior staff people from our various offices who are here to engage people and make sure that they get follow-up treatment. Could we take one moment just to identify who in the audience is here representing which office, so that folks that are here know that if they don't get a chance to testify, they can go talk to someone?
Sure.
And I don't, if it's okay with you, I'll just kick it off. Would the fish team please stand so that people can just see who you are? Okay, so we got 3 all-stars from the fish team. They're going to be here for 2 hours. Again, if you don't get a chance to testify and you have a concern, please see Sonia Schmansky, my chief of staff, or one of the 2 other women that are here. Thank you.
Very good. And who's on the mayor's team? Let's hear it for the mayor's team. All right. Woo! Excellent. Good.
Team Udaley.
And I'm listening myself and my staff are not here.
Thank you. Thank you.
Is there anybody, well, this was going to be a dumb question. I know the closed captioning isn't working. It is going out on the live feed for those of you who are concerned. We're working on getting closed captioning up here. And I don't know if there's anybody in the audience who's relying on that, but we are working on that. Okay.
None that I can see. Okay. And so, in addition to what Commissioner Fish said, yes, the testimony, it's a limited amount of time, and we're limiting it to 2 minutes of testimony from public testimony. However, there are other ways to do this as well. There is a Post-it note, sticky note chart outside, so if you don't get to speak and you have ideas, and I find this works really well when you're in the moment and you've got that idea and you don't want to go home and find the way to put that online, you've got it right here. We get it in the moment. You also have the ability to write in online your comments, and I'll go into this a little bit more in detail when it's time for this part. And now we also know who is here with the commissioners, so feel free to, that's the idea, is to get your opinions and your ideas today. Any other questions or comments? Okay, we're going on. So at this point, I would like to talk a little bit about the panel that we have assembled. It includes outreach, shelter, mobile service, affordable housing, and renter services staff. As you hear, they represent valuable long-term community partnerships. The way this session is going, the community work session is an opportunity to spend more time on one single issue and have a conversation in this context with community members who know about many facets of chronic homelessness and permanent supportive housing. Our goal during the invited testimony is to provide council an overview of the elements of the continuum of services that lead someone from chronic homelessness to supportive housing, and the protections that help them keep housed. Did I say that right? In addition, there are several opportunities for public testimony, and again, I'm going to say these again because we really want to hear from you. Public testimony on any topic. This event will include public testimony by random drawing. Again, the ticket's outside. You may also submit testimony online, the comment cards at the information table, and also the sticky notes. All of these comments will be provided to the council. And I have page 1. I'm going for page 2.
I got a note saying closed captioning is working on the live stream now. Okay.
And we just received information that closed caption is working on live stream. Yes. So the next thing is to invite Jessica Kennard up to talk about budget overview.
Good morning. I have a PowerPoint presentation, and wait for just a moment to see if it gets pulled up. So I will be very brief because I know you're not here to hear me speak. I do want to provide a little bit of budget contextual information to empower and inform your testimony and your engagement efforts today and in the future. Presentation coming up. Okay. I'm going to go ahead and continue as though you can see the presentation, and we will post it online. So our city provides services through 27 different bureaus, and they're divided into largely 6 different major service areas. We typically provide services in the areas of transportation services, public safety, which includes police, fire, the 911 call taking system, as well as emergency management services. We provide a host of community development services, which, as you know, includes housing and homeless services, but it also includes planning and sustainability services, permitting, community and civic life, and others. We provide parks and recreation services. We provide public utilities, which includes the water and sewer and stormwater services. And then we also provide a host of internal city services to support all of those programs. So as you probably know, we're not the only game in town, and we have some important partners with us here today. We provide services in partnership with a number of other local jurisdictions to provide comprehensive services to you all. So the county is an important partner. Multnomah County is featured here, but we actually in Portland have 3 county partners, Washington, Clark, and Multnomah County, and they provide human services, public health, libraries, assessment, elections, the district attorney, and many other services. TriMet provides bus, light rail, commuter rail service in the region, and Metro provides plans for the future of the Portland region and provides regional parks, venues, and services that cross city and county lines. So the net city budget is $4.2 billion, and that's comprised of, on a basic level, of what we call dedicated and discretionary money. The vast majority of the resources are dedicated, which means when they come into us, they're dedicated towards specific purposes. So for example, when you pay your water and your sewer bill, the city can't take that money and then spend it on any service that we like. We have to spend it on those systems to maintain those water and sewer systems, those costs. What we talk about most often when we talk about our budget priorities is typically focused on what we consider our discretionary resources, which are the funds that have very few restrictions on what we can spend them on. And that's a small portion of the budget. That's about 13%, which this year equaled $566 million. So in terms of where we spend our discretionary resources, you can see this tree map here shows the public safety category, which again includes police, fire, our 911 system, and our emergency management system comprises the majority of our discretionary resources at 58%. Parks and recreation comprises about 12% of our discretionary resources, and community development, which the large portion of that is for homeless services, is about 11% of the total budget this year. So this year, the city gave budget guidance asking all bureaus to build their budgets within 99% of what we call their current appropriation level, which essentially would mean a 1% reduction in their budget. But what this chart aims to show is that every year bureaus also receive an increase for their inflationary costs. So the blue bands are the dollar increases that they receive for inflationary costs, and the 1% reduction is the red. So even though there's a 1% cut, in real terms, each bureau is receiving more resources than it did last year. Available discretionary resources are divided into two types. When money is anticipated to be available for at least 5 years, we say that those dollars can be used to support ongoing programs and practices. So these are things like staff or expanded programs and expanded services. This year, assuming that 1% reduction, the city economist anticipates that we have about $1.7 million in surplus ongoing resources that can be used towards these ongoing programs. Additionally, we have an anticipated availability of $14 million in what we consider one-time resources. So these are funds that we think are available now, but are likely not to be available in the longer term. So we advise that council spend those resources on things that are one-time in nature. So this is things like fixing buildings, fixing streetlights, one-time costs. Additionally, the Parks Bureau is facing a structural deficit of $6.3 million that they have to address as part of their budget process, and the city is also addressing and considering, and that is largely comprised of the Recreational Services Division. That's where most of the shortfall is contained.
Jessica, can I just make one comment
Yes.
about that?
Yes.
We're not here to talk about parks, but there was a slide earlier that said that in our general fund each year we increase the amount that people got from last year with certain inflationary factors. So we build in cost of living, PERS, and other things, and that becomes the current year allocation. So all of those things get ramped up. Some of our city functions are funded not by general fund, but by something called fees. And fees don't generally go up 8 to 10% a year to cover inflation and other factors. So one of the reasons we have a challenge in parks is that such a big chunk of our business is paid for by fees, and fees would have to go up dramatically to keep pace with inflation and other costs of living. And if we were to do that, we would also be closing the door to people that we're trying to make sure can access our services. So therein is the delicate balance, and one of the reasons why we have a structural deficit.
Thank you, Commissioner. So here we are in our budget calendar. We're in the middle of the budget development process. It takes many months, and we are at the green square in the middle, having our budget outreach events. On May 1st, the mayor will release his proposed balanced budget, followed by the approved budget, which we will have a work session for on May 14th. And then finally, in June, council will adopt the budget. So we have a host of information, a wealth of information rather, on our website, the City Budget Office website. I encourage you to go there and check it out. We have, you can submit a comment there, a public testimony comment, and we will provide that information to council. You can also check out our performance dashboards citywide. You can drill in to see what each bureau spends their money on, where their revenue sources are, a whole bunch of information. So that's portlandoregon.gov/CBO. Additionally, you can contact me. I'm going to scroll back to the beginning here. My email, or our city budget office email, is right there on the screen. Feel free to give me an email, shoot me an email if you have any further questions or want to talk any more about any of this. Thanks.
Thank you, Jessica. So before we go on with our panel presentation, I would like to invite 4 of our panelists to come up and sit and be ready to speak. And that is Katrina Holland, Shannon Singleton, Stacy Bork, and Julia Delgado. And as they're coming up, I would also like to introduce and invite Shannon Callahan and Patricia Rojas.
Good morning, everybody. I am Shannon Callahan of the Portland Housing Bureau. Thank you for joining us this morning for this important discussion. As I'm speaking, I'm just trying to make sure that I am pulling up the PowerPoint that we'll be using to talk about this morning. So this morning I am going to be providing you with a high-level overview of the Housing Bureau's budget, with a specific emphasis on how, in partnership with the Joint Office and our community partners, we are working to provide permanent solutions for people experiencing long-term homelessness. As Francis mentioned, we have invited our community partners here to help provide you a closer look at the priority area of work, one of the priority areas for our work this coming year, supportive housing. Supportive housing combines deeply affordable housing and support services to house folks who are experiencing long-term homelessness, a population that is most likely to be unsheltered in our city. Now would be a great time to put up the PowerPoint, if anybody can hear me. Okay. So broadly speaking, when we have a PowerPoint that goes up, you will see that the Housing Bureau's budget prioritizes stabilizing families in their current homes, and so I guess it was me that was supposed to be doing this. There is not some magic person somewhere behind the curtain as I was expecting. Oh, there we go. Woo, okay. All right. So broadly speaking, the Housing Bureau's budget prioritizing stabilizing families in their current homes and the creation of new permanent affordable housing. We provide support to renters through our Renter Services Office and with local tenant protections. We fund community partners to protect from discrimination in housing and provide legal assistance to tenants facing evictions or housing discrimination. We also support long-term low-income homeowners with home repair programs and foreclosure prevention programs. I would like to mention that we also have a number of different budget requests this year called Directions to Develop that I'm not going to be going through in detail this morning, but over by the introductory table where you came in near the food is a detailed handout listing all of those directions to develop and what those requests would entail. They are predominantly focused on increasing services for our Renter Services Office. The majority of the Housing Bureau's budget, as you saw from that slide, is prioritized for creating new permanent affordable housing, ensuring that families have safe, stable, and affordable rental and homeownership opportunities. Just to give you a glimpse into the housing that we have funded over the last decades, the Housing Bureau has funded and created more, with our partners, more than 14,000 units of affordable homes, providing over 20,000 Portlanders with permanent affordable housing. On average, our residents have make just over $17,000 a year and pay a rent of just over $500 a month. The housing we support also houses a high percentage of folks who identify as elderly, and 27% of our residents report a disability. In this year's budget, much of what our budget is going to support is the creation, as I mentioned, of new affordable housing. This gives you a glimpse into the 2,000 units and where they're located that we currently have under development with our partners. As you can see, they are located all throughout our city, and we will be bringing units online this year and next year, and the development funding in our budget supports the ongoing development and construction costs related to creating these units. But as we talked about this morning, one of the focuses of the discussion today is really about our work regarding supportive housing. There are many pieces of our work that, all of our joint combined work that go to solving homelessness, but really what many of our fellow Portlanders need is deeply affordable housing with ongoing wraparound services. Supportive housing provides people with severe disabilities, including those with mental illness and addictions, a home and the support they need to be successful in their housing for the long term, and not sleeping on our streets or cycling through institutions. This is why in 2017, both the city and the county established a joint goal to create 2,000 new units of supportive housing by 2028. Since establishing this goal, we as a community have worked to create new supportive housing. We've already opened 182 new units of supportive housing, and 482 units are currently in our development pipeline. Many of these units will have their capital supported by the voter-approved Portland Housing Bond. Supportive housing can take a variety of different physical forms, building types, and locations. In the development and planning phase are 4 new buildings providing deeply affordable housing with on-site intensive support services. Central City Concerns, Division Street Commons at 113th and Southeast Division will provide 60 units of low barrier, deeply affordable housing, serving individuals with mental health issues. In partnership with Do Good Multnomah, Home First, and St. Mark's Lutheran Church at 54th and Southeast Powell, veterans who need supportive housing will find new homes for as low as $350 a month. And the Portland Housing Bond will create 2 new 100% supportive housing buildings in the Central City at the Joyce Hotel and the location of the West Wind Apartments. To achieve our goals and provide the type of housing that different folks need to be successful, we will also be scattering supportive housing throughout our entire rental portfolio. Scattered site supportive housing allows the integration of housing in a larger affordable housing complex, some of which will be served by on-site services, and some of which will be supported by the Joint offices and Joint's mobile housing supportive housing team. So just to kind of give you an overview of what both Patricia and I have been talking about and how these concepts work together and what you're going to be hearing from our panel, we of course work at the front end to prevent folks from becoming homeless. It's of central importance that we provide renter protections, renter services, and short-term rent assistance. We also have a robust homeless service system, which Patricia will be diving into in more detail. And then, of course, for those folks that need it, moving them into permanent supportive housing with those important wraparound services. And now I'd like to introduce Patricia Rojas, the Deputy Director of the Joint Office of Homeless Services, to talk a little bit more about their work and how it integrates into this complete system.
All right, good morning, everyone. Thanks so much for joining us this morning. My name is Patricia Rojas, and I'm going to be providing a system and budget overview of homeless services with a focus on moving people out of chronic homelessness and into permanent housing. Before I jump into this slide, the Joint Office has a value and a commitment to racial equity. And each community has unique circumstances, needs, and strengths, and it's important to capture, analyze, and report data disaggregated by race to better understand those circumstances and close racial disparities. A link to the disaggregated data and a full report of outcomes for the Joint Office of Homeless Services is going to be included at the end of this presentation, but due to the short nature of today's presentation, the racial data will be provided as an aggregate, showing participants who identified coming from communities of color. Our community has a vision and a strategic plan to end homelessness called A Home for Everyone. That vision and plan is advanced by a collaboration of elected leadership from the city and the county and a broad range of community stakeholders, including those with lived experience of homelessness. The core values of A Home for Everyone and input from the coordinating board help us to think systemically about how to prioritize those who are most vulnerable and how to advance and promote racial and ethnic justice. We're always looking for ways of incorporating the voice of the community and increase or protect leverage. Our homelessness response system continues to be challenged on multiple fronts, but the dynamic that correlates most with the rates of homelessness is the growing divide between income and rent. From 2010 to 2016, median rents increased 52%, while median renter incomes only grew 19%. And those averages don't hold true for our lowest income households. In the same period, the maximum SSI benefit increased only by $59, which is just under 9%. And our biggest challenge is at the level of people making 30% of AMI, which is $17,000 per household per year for a household of one, and for a household of four, that's $24,000 a year. Over 70% of these extremely low income households are severely rent burdened, which means that they're paying more than 50% of their income on rent. The result is that we go into this budget cycle with enormous unmet current need, and there is an ongoing and substantial risk of new inflow into our homeless response system. 29,000 households in Multnomah County are considered to be extremely low-income households at 0 to 30% AMI, and again, are spending more than half of their income on rent. This slide shows that we have a combined approximate about 30,000 households waiting on wait lists for some type of housing subsidy. For the Joint Office of Homeless Services, that looks like 1,400 families currently experiencing some form of homelessness or extreme housing instability that are waiting in the queue for housing assistance, and over 2,500 households, primarily disabled adult-only households, waiting in the queue for supportive housing units, both permanent supportive housing and transitional recovery housing. So here we showed that despite all of the challenges, our systems have continued to serve more folks. Between 2014 and 2018, we see that in placement, we have increased by 87%. We have increased prevention services by 48% and shelter by 84%. And if we look at the last two sections of prevention and shelter, for prevention, it's taking more resources to keep people housed because of rising costs of rent, and it's also requiring just more subsidy. People are in deeper need. And then for shelter, without affordable housing, it's really hard to move people out of shelter. And so we need to have more affordable housing, which is, again, to Shannon's point, so important to build affordable housing. We do have values in our system that guide everything that we do. We want to prioritize vulnerable populations, promote racial and ethnic justice, use data and driven assessment and accountability, engage and involve the community, and strengthen the capacity of our system and increase leverage opportunities. And the way that we focus our services is in three primary categories: prevention, shelter, and then placement into permanent housing. Over 50% of our budget is invested in housing placement and services. The Joint Office has requested a current service level budget of $67 million, which includes requests to restore all proposed reductions from both the city and the county. This slide shows that, in summary, $32.6 million of our budget comes from the City of Portland, $26.5 million from Multnomah County, and $7.6 million in federal funding. And we'll now move to looking at the service areas. This is 20% of our budget, with a total of $20 million going into shelter operations. As you can see, this includes more than 1,400 year-round shelter beds and another 300 winter shelter or seasonal beds. Our ever-evolving shelter operations are an enormous part of our office's work. We fund a range of population-specific shelters, like those supporting our veterans and families, to more traditional 24/7 shelters and alternative shelters like our villages. We continue to make progress towards higher quality 24/7, 365-day-a-year shelter across our systems. As an ending homelessness effort, we continue to direct the majority of our resources towards housing-related investments, permanent supportive housing, and shorter-term housing placement and retention programs. Last year, these programs moved into housing and provided post-placement supports to almost 12,000 people. 60% of those people identified as people of color. This is also where you find supportive housing investments, the funds that we're pairing with PHB's bond projects. What we show here is that 1,800 people were diverted from homelessness into alternative permanent living situations, which is one of our most cost-effective investments. What this looks like is for folks that might be at imminent risk of homelessness, maybe somebody has an eviction notice, and they just need a little bit of financial support to be able to pay for a move-in cost. Those are the folks that we're talking about here with diversion services, and it's incredibly effective. So we've actually launched several innovative pilots like hospital diversion, criminal justice diversion, and shelter diversion projects. And the last service area that I'll mention, but it is not the least, is employment services, which looks like youth and adult employment services and also benefits assistance. Last year, over 400 people were enrolled in employment services, and this resulted in 185 people obtaining employment. We'll now move to our panelists, who will speak to how they engage people through outreach, provide access to services, and prioritize those who are most vulnerable for supportive housing, how we offer service-enriched and alternative shelter while people work towards permanent housing, the assistance we provide with housing placements, and the supports it takes to help people in retaining their housing. Our panelists will also speak to the development and operations of different types of supportive housing. We have encouraged the panelists to pay particular attention to how their work addresses racial disparities. The racial disparities we see in the chronic homeless population and in homelessness in general. It is important to recognize that while today's panel is focused on chronic homelessness and supportive housing, the Joint Office's work and our budget also prioritizes families with children, homeless youth, domestic violence survivors, and adult-only households that do not meet the definition of chronic homelessness. Similarly, the housing that PHB develops and PHB's work on tenant protections reaches many households that have not experienced chronic homelessness, but are no less in need of both affordable housing and tenant protections. So I'd like to now move to our panelists. I'd like to reintroduce Katrina Holland, Executive Director of the Community Alliance of Tenants, Shannon Singleton, Executive Director of Join, Stacy Bork, Director of Programs at TPI, and Julia Delgado, VP at the Urban League of Portland.
Just a note on process. You have roughly 3 minutes, and our timekeeper is down here, and she'll give you a gentle reminder. And the other one is coaching on the microphones. As I understand it, it's about 3 fingers from here, and aim it at the chin, not at the mouth. And I think with that, we can begin.
It's really supposed to be that close.
Very good modeling
Right.
from Katrina.
Good morning, everyone. As stated, my name is Katrina Holland. I serve as Executive Director of Community Alliance of Tenants, a renters' rights organization that has been in existence for 22, almost 23 years now. We are a hybrid services and advocacy organization, primarily focusing on trying to prevent people from experiencing homelessness through education and outreach opportunities for folks that may be experiencing trouble with their landlords and or evictions or any sort of displacement event that they may be facing as renters, in addition to advocating for policies that would prevent homelessness or help get people off the streets and into permanent homelessness. So the need for housing services stretches across a vast spectrum of housing experiences, as we've heard today. On one side, you have someone who has little to no access to due to varying life circumstances. They're on the street with little chance of finding a permanent home, with no desire to live in shelters due to personal beliefs, desire for a modicum of safety and privacy, or perhaps even that shelter won't work for them because of physical or mental conditions. The other side of the spectrum are people secured in housing that they own with little to no barriers in maintaining that housing. And perhaps there are some concerns for potential impacts of policy changes, city investments, that might change property values and increase taxes, among a myriad of other things. But between these 2 points often lies the forgotten, which we're happy that the Portland Housing Bureau and Joint Office of Homeless Services has prioritized. And these are people in housing who are on the verge of losing housing, accessing housing, and potentially going to lose housing based on various market indicators or trends. These folks are often invisible because they may or may not have hit the system seeking support quite yet. And they may not have to ask for rent assistance quite yet. They may not need housing relocation supports for moving. They are lucky and experience the privilege of having a modicum of what's considered enough. Not only are many of these folks vulnerable because of different physical characteristics or socioeconomic conditions and or lack of opportunities, but they are also vulnerable because the law allows them to remain in a vulnerable state. There are low-cost upstream options of supporting many of these families before they hit rock bottom or become close to hitting that point. And if these folks never have to hit the system due to lack of resources, we potentially save a lot of money. Our experience demonstrates that some causes of homelessness are simply the result of poor policy, unregulated engagements between landlords and tenants, and a lack of understanding about folks' rights and responsibilities, and a lack of protections for tenants. We can pour money into one end of the spectrum, that is supporting people once they hit the system, hoping that things will get better, all the while seeing a steady stream of inflows into new and chronic homelessness. Or we can balance our investments to prevent people hitting the system altogether by passing tenant protections that could keep people in their homes as upstream preventable measures of homelessness even before rent assistance. And that works just as well, if not in some cases better. We can also support people exiting the system by supporting tenant protections that increase access to housing, thereby potentially saving money, because folks may avoid using the system altogether when trying to enter into housing and pay the cost to get in, i.e., City Council, please vote yes for screening criteria and security deposit reforms so folks can get better housing choice. We've all heard it time and again, but I'll say it once more. We are in a housing crisis. And yes, we understand that resources are scarce, limited, and we're looking at a deficit. But one thing that cannot be touched is the commitment to invest current and more resources for addressing our housing crisis. Tenant protections and investments in homelessness prevention services are critical. So let's keep trying to address the influx of folks into new homelessness and spend our money wisely.
Hi, I'm Shannon Singleton, Executive Director at Join, and we have a number of programs that touch folks who are currently experiencing homelessness or have been able to win the lottery, frankly, and find another new apartment that they can move into. I want to talk very briefly. Our street outreach team is a team of 8 folks who cover the entire county. I want to repeat, it's 8 people for the entire county. Really seeking to connect with people who are on the street, sleeping in wooded areas, in doorways, and help them connect back into housing. We do placement straight from the streets into permanent housing and do some wraparound support services. We also have an additional team that we call the Inreach Team, and this team in particular is an innovative project where it is a partnership with a number of culturally specific organizations, as well as domestic violence services. And this team is specifically designed to go to sites like Dignity Village, Right to Dream 2, Rosehaven Day Center, Willamette Shelter, and other sites that don't have internal access to housing placement services. This has been a really amazing project, and I want to share that within these first couple of months of 2019, we have about 60 people from just Rosehaven and Gresham Women's Shelter engaged in a housing process and likely to be placed within the next month or so. The importance of this program in particular, I think, is that we're bringing all of these different resources to the sites so that somebody staying at Dignity Village, for example, who wants mental health services, who needs linkage to domestic violence services, doesn't have to go and try and find all those different doors. We also, as it was mentioned, have a mobile permanent supportive housing team. This team is also an interdisciplinary team of multiple agencies, including culturally specific providers, addictions treatment, mental health peer staff, and mental health clinician. This team in particular has been connected primarily with bond projects serving families and individuals who need a higher level of supportive services to maintain their housing. It's been absolutely amazing, and every single person who has been placed and served with this project is still in their apartments over a year later. One other piece, this is going so much faster than I thought. One other piece I wanted to share a bit about is our Landlord Recruitment and Retention Program. And this team was specifically designed to help us navigate the challenge of deploying vouchers that we have in our community. It started with focus on the Veterans Initiative and really helping to open up doors in private market rentals to get people into those apartments. They are now serving the Inreach Team, the Homeless Family System of Care, and will be working with Home Forward and many county services to deploy the new mainstream vouchers that we recently received for the community. That team as well is doing a ton of education and really helping landlords understand fair housing, why it's important to connect with homeless services, the types of resources and supports we can provide folks. And they also have a risk mitigation fund, which gratefully we have not had to use a lot of.
Thanks, Shannon. Thank you, Mayor Wheeler, Commissioners, thank you so much for having me. My name is Stacy Bork. I'm the co-chair of the Home for Everyone Coordinating Board and the Senior Director of Programs with Transition Projects. Based on the presentation that we heard from Shannon and Patricia, I'm hopeful that you can see and feel the impact of your support over time and how it's life-changing and life-saving for thousands and thousands of Portlanders. I'm going to speak to two of the many ways that services are tailored to reach and impact people who are chronically homeless: coordinated access and shelter design and shelter flow-through. Maintaining eligibility and being competitive for federal resources is one way that we leverage local investments. And for people who are chronically homeless, we do this through coordinated access, which is a strategy to prioritize very vulnerable people for housing resources, including permanent supportive housing, PSH. The team of people who engage and connect people to coordinated access is called the CHAT team. And they are from El Programa, Transition Projects, Urban League, and NARA. And they focus on outreach in traditional and non-traditional places to ultimately increase the equitable access to PSH. Their primary task is to make sure that people who need it most and who are often underserved have meaningful access to permanent supportive housing. They're going into hospitals, they're going into detox programs, they're going into faith communities, they're going into camps, they're going to meal sites to help to find people and to reach people who are not accessing many other services, or maybe who have not seen a service provider, had a meaningful contact with someone who really wants to help them move back into housing. By increasing outreach to and setting goals to improve how we engage and serve people who are chronically homeless, it means that we've had to look at every single part of how our system works, which brings me to the second way we impact the lives of people who are chronically homeless: shelter design and shelter flow-through. The safety off the streets planning that we've done led to the redefinition of how we do shelter. This shift led to a 22% increase in the number of people with disabilities who are accessing a shelter bed. Shelter beds in our community have low barriers to entry, which ultimately allows us to serve the people that we're reaching through street outreach and through these non-traditional ways of trying to engage people. And these, well, I got a little off track there. Through street outreach and those in camps, and ultimately people that are waiting to get into a permanent housing. And those shifts had impact. We saw a 16% reduction in unsheltered people on the streets who are chronically homeless. Our shelters are service rich. They have health clinics, they have income and benefit supports on site, they have wellness and peer supports, housing advocacy built in and available. We want to be able to welcome people in, provide safety off the streets, but ultimately focus on how do we help you move forward. This all leads to striving to ensure that people have access and connection to what they need, but most importantly, that shelters are not destination points. It's not a landing. It's not a final stop. Our shelters should facilitate real pathways back into housing. Rent assistance, deposit help, housing debt reduction, ID assistance, and housing advocacy make housing pathways possible. Thank you.
Thank you. I feel like I'm far from the table. Okay, let me scoot it. Hi, everybody. Thank you very much, Mayor and Commissioners, for inviting me. I'm Julia Delgado. I'm the Vice President at the Urban League of Portland. The Urban League of Portland is a historic and current civil rights service and advocacy organization. As a 75-year-old trusted resource for Black communities in Portland, Urban League sees the crisis of homelessness in every single day in every single service area. The lack of safe, stable, affordable housing accessible to African Americans is the single greatest need in our community. We appreciate the investment in culturally specific organizations to serve people who are both overrepresented in homelessness due to systemic factors and who have not been served effectively by mainstream organizations. Urban League most recently began offering services to people experiencing homelessness in 2014, and we operate currently a robust street outreach team, a diversion prevention and rapid rehousing program intended for Black Portlanders and with an emphasis on the reentry population. And we currently offer a 50-unit scattered site permanent supportive housing project that is culturally specific for African Americans who have disabilities, who've been experiencing chronic homelessness. In addition, we're really happy to work alongside mainstream providers like TPI and Join in projects that have already been outlined by my two other panelists here. And we really like those multi-agency collaboratives because we think they really facilitate a lot of shared learning, and they allow us to work in our culturally specific model while still accessing mainstream supports. We're pleased with the commitment from the city to address racial disparities in the homeless population. With the support from the Joint Office, we were able to leverage HUD funding and existing case management to provide wraparound services and housing stability to more than 450 African American-led households in last year, at very minimal cost. We're also leveraging our relationship and 75 years of service and trust to the Black community. So people reach out to us who have long felt excluded from mainstream safety net services, people who would not walk into a homeless shelter, people who would not call a crisis line. These are people that we're serving every day. The median length of homelessness for the 43 Black adults in our permanent supportive housing program is 4.5 years. Those years come at a huge cost to our community in emergency services, shelters, jails, and excessive policing. They all cost our city millions of dollars, but those years come at a much greater cost to the individual. One night on the streets is traumatic, yet years of uncertainty, harassment, illness, exclusion, and fear from not having a fixed place to rest come at a huge cost that no one should bear. I'm not going to be able to give my testimony. I really thought this was going to be shorter. So I know there's urgency around permanent supportive housing, and we support that, but we really encourage the city to continue to invest and plan for prevention. As the most recent State of Housing report indicated, the average African-American household cannot afford to rent or buy in any area of the city of Portland. Coupled with an unemployment rate for African-Americans in Portland that is twice that of white Portlanders, generation after generation of unchecked gentrification and displacement, and the dismal results of the most recent fair housing discrimination testing, it's easy to see there's a crisis looming in our community. A focus on prevention is paramount. If we are really to truly forge a progressive path forward, then we need to take a step back and learn from those from lived experience and frontline practitioners who know the most effective solutions exist at the intersections of the public service systems. I'll stop there. I'll submit the rest.
Thank you. Excellent, excellent presentations. Appreciate it very much.
Thank you very much. We always need more time, don't we? So our next four for the second part of this panel, Amy Thompson, Chris Iosa, Sean Hubert, and Melissa Arnold. Amy Thompson is with NARA, Chris Iosa, Do Good Multnomah, Sean Hubert, Central City Concern, and Melissa Arnold, Home Forward.
Okay, good morning. Can anyone hear me? Okay. It's an honor to be here today and have the opportunity to talk about culturally specific supportive housing services. I'm the Director of Housing Services at the Native American Rehabilitation Association of the Northwest, also known as NARA. NARA provides culturally specific clinical services for the Native American community in the greater Portland area. Our integrated services include substance use disorder treatment, mental health services, primary health care services, dental services, and an array of supportive services to assist individuals and families achieve the highest level of self-sufficiency possible. These supportive services include street outreach programs, housing assistance, supported employment and education programs. Our permanent supportive housing services currently provide 70 vulnerable, previously homeless households with an ongoing rent subsidy and access to supportive housing specialists who support these households to maintain their housing and achieve their personal goals. Data from the 2017 point-in-time count show that 10% of the homeless population in Portland identify as Native American, whereas Native Americans represent less than 3% of the overall population in Portland. Native Americans who are homeless experience unsheltered homelessness, chronic homelessness, disabling conditions, poverty, and violence at rates significantly higher than any other race or ethnic group. Many homeless Native Americans experience challenges when trying to access mainstream services for multiple reasons, including safety and discrimination concerns, the effects of multiple trauma, including historical trauma, a distrust of government systems, and other cultural barriers. culturally specific services within each component of the overall homeless services and supportive housing systems are key to addressing these disparities. Now, our outreach staff are able to quickly build rapport with individuals who have experienced difficulties engaging in services in the past. NAR is well known within the Native community, and staff are trained to address the cultural needs of individuals and families they are working with. They understand the common values shared among Native American communities. Excuse me. They provide assistance navigating housing resources as well as clinical services. NAR's supportive housing specialist staff are qualified mental health professionals who can provide behavioral health services and also ensure individuals have the opportunity to engage in more formal, culturally specific treatment services if they wish. NAR is thankful for our many collaborations with other service providers, including a current collaboration with Central City Concern, Home Forward, and the Joint Office for Homeless Services in a project that provides permanent supportive housing at CCC's Hazel Heights complex. Through this collaboration, 20 households, mostly families, living at Hazel Heights receive ongoing rental assistance and supportive services provided by NARA. Staff help these families to achieve housing stability by facilitating access to other services such as health care, benefits such as SNAP, behavioral health care, again, dental services, supported employment, etc. This project has provided the opportunity for these 20 households to get off the streets, including single fathers and mothers who have been able to reunite with their children as a result of this project, as well as individual adults whose medical conditions were greatly exacerbated while living on the streets long term, which required frequent and expensive emergency room visits and hospitalizations. The housing specialist engages these families, provides access to needed medical and behavioral health services. They provide skills training to help those households achieve a higher level of independence, and they provide crisis intervention services when needed to preserve housing stability. This is just one example of NAR's supportive housing program, which currently provides 70 households with this type of support. We also have outreach and engagement and housing placement programs that are serving approximately 75 individuals each month. And I think I'm at the end of my time, so thank you very much.
Are we going in order? It doesn't matter. Thanks. I have no idea. It's the order sheet. Good morning, Mayor Wheeler, Commissioner Fritz, Commissioner Fish, Commissioner Udaley. Thank you so much for giving me the opportunity to speak on this important topic. I'm going to try and get through this. I get really super emotional when I talk about the work we get to do. I hope that somebody will stop asking me to talk, but that hasn't happened yet, so I'm here. Although we continue to see high rates of veterans experiencing homelessness on the streets of Portland, I would be remiss if I didn't acknowledge the amazing work that the City of Portland, Multnomah County, community partners such as the Joint Office, A Home for Everyone, and other community partners such as Do Good Multnomah have done to combat veteran homelessness. Programs such as our veteran-specific emergency shelter have been extremely successful and important to this community, to identifying veterans, to getting them off the streets. Programs like our rapid rehousing and eviction prevention to help veterans afford to get into housing, to maintain their housing, has been extremely important. But the last point in time count, we've identified 40% of those veterans were unsheltered. That means not accessing shelter of any kind. And so we need to look at new and innovative ways. And so I'm excited when we talk about projects such as a tiny home village in St. John's. Do Good Multnomah right now is operating a tiny home village in Clackamas County specifically for veterans, which is extremely successful. Shannon Singleton spoke a little bit about the resources that come to these villages as opposed to individuals having to navigate resources. And it just makes it extremely beneficial and advantageous for resources to come to individuals as opposed to the other way around. We're also extremely excited about the work that we're doing currently at Sandy Studios, which is 50 units of permanent supportive housing for veterans-specific community. This opportunity given to us has been extremely beneficial for veterans to build community within themselves, within their walls, and that we can help them to engage with the community at large. So finally, we're extremely and just overjoyed that our project for the SRO and one-bedroom units, an innovative project, veteran-specific, was funded and is in the pipeline. We believe that this project is just an amazing opportunity for individuals to afford units, to maintain units with intentional support services to make sure that individuals can maintain housing and then become self-sufficient. So thanks again. I really appreciate the time.
Good morning, Mayor and members of the Council. I'm Sean Hubert, Chief Housing Officer for Central City Concern, and I wanted to talk today about the important role of the intersection of homelessness and chronic homelessness and addiction and mental illness.
Sean, could you talk a little louder just so we can hear you?
How's that? Okay. It has been said that the barrier to change is not too little caring, it's too much complexity. And homelessness and its many adjacent issues can be pretty complex. At the community level, homelessness is caused by a lack of affordable housing. At the population level, the evidence tells us that the key predictors of homelessness center around criminal justice system involvement, substance abuse, mental illness, chronic untreated disease, or episodic employment history. But at the individual level, homelessness is often about the intangibles: broken relationships, trust or distrust, or the impact of repeated trauma, stress, and stigma. If a community is going to achieve lasting success, it must meaningfully engage across not some, but all of these issues. The good news is that today the city, the Joint Office, and the organizations here before you are collaborating more effectively and across a wider spectrum of these issues than ever before. And I wanted to talk just a little about two such partnerships in East Portland between CCC and the city, which highlight this evolving work. First, the Blackburn Center, set to open in just a few months, will bring together both transitional and permanent supportive recovery housing, total health care, and employment services. While many communities' employment services are not among those funded as part of a homelessness strategy, they are shown to improve not just housing stability, but also overall health and recovery outcomes, and are shown to actually generate a savings over time in terms of reduced rent assistance and other public supports. And secondly, the Division Street Commons project, which will provide permanent supportive housing for people living with mental health issues. That will include supportive means not just professional mental health care, but also employment, benefit acquisition, and opportunities for real social connectedness and community integration. Together, these two projects will provide housing support to about 1,800 people over their first 5 years of service. And critically, the city is supporting not just the bricks and sticks or the construction of these, but also the services and interventions which move people beyond tenuous to lasting stability. When you look at the interplay of these issues, you find a mutually reinforcing cycle. Addiction or mental illness increases the risk of homelessness. Homelessness increases the risk of addiction or mental illness. And sorry, I lost my place here. But an addiction or mental illness actually increases the risk of chronicity or chronic homelessness. So to achieve lasting success, you have to intentionally intervene and disrupt these cycles. These kind of investments that we're talking about here today do just that and are the right kinds of investments to be making. And while this is a budget hearing and we tend to view these as costs, they are in fact the purchase of savings over time. Thank you.
Thanks, Sean. Can you hear me? Yeah. Good morning, Mayor, Commissioners. I'm Melissa Arnold with Home Forward, or Communities Housing Authority. All interventions aside, we end homelessness with affordable housing, federal rent assistance, and flexible local dollars. As you've heard, to achieve supportive housing, we combine a physical unit, rent assistance, and supportive services, and it's incredibly effective. Home Forward funnels federal dollars into our community through rent assistance programs, and this plays a major role in how supportive housing is subsidized. Federal rent assistance dollars also help maximize local investments in affordable housing creation by tying ongoing federal revenue to actual units. For instance, Home Forward committed 400 vouchers to support Portland housing bond units, ensuring the voters' investment can sustainably serve some of our most vulnerable neighbors and reduce inequity. Local money helps draw federal revenue to our community's housing crisis. When we use federal money quickly and efficiently, it ensures those dollars stay here at home and helps us compete for new resources. By working together, we've increased the supply of supportive housing vouchers for our community through increased utilization rates. Most federal tenant-based PSH programs like VA supportive housing and Shelter Plus Care won't pay for many aspects of acquiring a stable home. VASH, for instance, pays for rent and a clinical VA case manager, but won't pay costs associated with finding and remaining in a home. Our community can quickly utilize VASH because of your local investment and flexible assistance to address the myriad small costs associated with getting into housing, like getting an ID, paying application fees, and bus tickets to go apartment hunting. Another example of your local money leveraging federal resources, our Shelter Plus Care program provides housing subsidy, but requires local communities to offer housing placement and retention support and services. Due to our strong partnerships, this year we'll lease up 378 new targeted supportive housing vouchers that we received in no small part as a result of our jurisdictional partners' commitment to providing aligned, flexible resources to get people into homes quickly. Still, only 1 out of 4 families that income qualify for our programs get federal help with the rent. By continuing to work together to address our housing crisis, we're slowly but gradually moving closer to appropriate federal funding. We need to continue our work to preserve and attract federal funding, but we also need to stay aligned and make smart, targeted investments today to slow our housing crisis. To this end, Home Forward and Joint Office helped create a pilot with community partners, some of which are here, exploring the viability of a locally funded voucher program. We call it LRA. For this pilot, we created strategic partnerships and utilized each other's strengths. These locally funded vouchers target seniors living with really low incomes and who are at risk of losing their housing because of rising rents and lack of affordable housing. It is a lean, mean, and nimble voucher intended to catch some of those folks who've fallen through the cracks of the other programs. Working together is how we'll solve this crisis. It's more cost effective, and it's absolutely the right thing to do. Thank you.
Mayor, can I just make one comment?
Yeah.
I want to just piggyback off of something you said, Melissa, and something about Home Forward, because I think when we talk about how we're going to address homelessness and affordability, we have to be clear that we can't solve the problem without strong partnerships. That means locally, but it also means we need a federal government that's a strong partner.
Absolutely.
I've had the honor of being both the housing commissioner, and thanks to Gretchen Kafori, I was the vice chair of the housing, then called the Housing Authority of Portland Board. And I just want to put make three brief observations. The first is the president's budget that just came out. At a time when cities across the country are struggling with affordable housing and meeting the needs of our lowest income residents, the president proposes zeroing out community development block grants, which is our most flexible tool, and I think even more cruel, zeroing out the public housing capital repair fund. So the very amount of money that you depend on to maintain the quality of the stock of public housing that you manage, the president has proposed zeroing that out. Number two, let's put in perspective what our federal priorities are. We have yet in the last 3 or 4 years to have a real discussion at the federal level about what should be our role with cities. We went through an entire presidential election cycle with the issue of affordable housing in cities never being mentioned. Maybe I missed it, but I suffered through most of the forums, and I don't remember it ever coming up. So hopefully that'll change because we're seeing candidates in this cycle begin to address. But number three, just going off old numbers, because I don't know how the president's tax reform package changed things. We'll have to see when the dust settles. I just want people to understand that the entire federal investment in what we call homelessness, affordable housing, all the things we're talking about today, is about $40 billion, plus or minus. The foregone revenue to our federal government of subsidizing people's mortgages, many of whom don't need it, and property tax deductions, and again, we're not sure under the tax reform how that's going to change with the SALT cap. But using old data was about $200 billion. So we give subsidies to middle-class people to help them stabilize their housing to the tune of about $200 billion. And I'm not here to argue against it. I'm just observing that we consider that a social benefit. 1/5 of that is the amount for everybody that's falling through the cracks. So it's sobering. So I think we should acknowledge that at not one point today has any panelist said, we're not prepared to step up and do our part. No one has said we're going to pass the buck and say the federal government is really to blame or the state's to blame or anyone else. But let's be clear, if we're really going to be successful in the long term, we can't be successful without a strong federal partner. And without that, we are relying increasingly on local resources, and those are finite. Absolutely. So I just want to make a little editorial comment.
Thank you, Commissioner.
Thank you for your presentation.
Thank you.
All right.
Thank you very much. So now we're moving into public testimony. And first, we would like to invite people who have lived the experience related to homelessness, housing, and insecurity. And I do have one person who has already come forth. All of these lottery tickets, they have 1226 as the first four numbers. Let me just tell you that this number is 885, 1226 885. So if that person could come up. Great, and I will just let you know that you have 2 minutes. And this is our timekeeper, and again, reminding you about the microphone about 3 fingers.
Okay. Here in America, land use policies and property rights they supersede natural rights of habitation. A lot of us, we overlook how much our tax dollars do for us when they spare us the need to fight over these things. I have 2 hands to make do with the land that was given to all of us, but I can't do so. A lot of you might justify this with age-old adages such as the American dream handed down from previous generations that land and property are things that can be earned, but objectively speaking, you can't justify earning land itself. People have God-given rights to inhabit land, and yes, even to grow roots and to develop community. Funny thing I've observed out here is that doing so seems to threaten people far more than does isolated pockets of drug dealers inhabiting a pissed-on corner. Why this is so is a rabbit hole you can fall into as deeply as you wish, but suffice it to say that the NIMBY battle is one of culture, not drugs, crime, or even resources. Nomadic culture versus sedentary culture is a battle that has played out for millennia. It's why gypsies are historically one of the most hated races on earth. Now, we live in an age that planners have come to call the age of cities, meaning we're being roped into large industrial cities like cattle. This is eventually going to bring the issue to a head, and it's going to force us to face the issue in a fundamentally different kind of way. To those seeking to address it in a way that accounts for both sides of the argument, please tell the Board of Commissioners on April 17th to allow Homer Williams to build his big green tent in the city that we almost learned to live together. And I'd also like to say that the strategies presented here today, they will not solve the issue. I'll have more to say about that at City Council next month. But decriminalizing life without property is both the more pressing issue and the more realistically achievable goal. Thanks.
Next, I would like to invite up, and we had no tickets for this, so anyone who is an elder, someone with young children, a student, people with disabilities, people who will be using simultaneous interpretation, or any other community member who needs additional accommodation, I invite you to come up to the table. Okay, come on up.
Hi, my name is Jason Kirk. I'm one of the founding members of Hazelnut Grove. I lived out there for 18 months. I've been in permanent housing through Cascade Behavioral Health for the last 18 months. I've had a lot of stuff said about me, and I've been able to take my reputation, grab it out of the raw sewage, and wash it off. and I'm doing a podcast for Street Roots on KBOO Radio, Google KBOO and Street Roots. I've got my next 3 guests in line. I do a monthly show. It's mostly poetry, but it seems like we're expanding scope at this point. There's 100 neighborhoods in Portland, and they're like little villages. And there's enough room in every one of those neighborhoods for a little tiny house village, in one shape, fashion, form, whatever. And I know how cheap they are. Be put in for about 100 grand, maybe 200 grand. Lots of city land out there, and let's see, 20 people in 100 villages, that's about 2,000 people. And it's not permanent, it's supposed to be transitional, and it's just another piece in the puzzle. Thank you.
Thank you.
So at this time, I'd like to begin inviting people up who submitted a lottery ticket. Just a couple of things. We do have stairs, and you can come around this way. We also have microphones on the floor if that is easier for you. If you have things to hand out, please hand them to me, and I will hand them to the commissioners. So again, we've sorted the comments into 6 topics: public safety, parks, recreation, and culture, public utilities, housing and homelessness, transportation and parking, and any other that you might prefer. We have drawn the tickets. I will call 4 numbers, and those people can come up and take a seat. You will hand your lottery card to the staff member who's over here, and then we will have 2 minutes per person, and we will have, again, watching the timekeeper. So let me start out with the first 4 numbers. Again, 1226 is on all of them. 887, 888, 887, 888, 914, 914, and 886. And we'll be coming up this way, up the stairs, and into these chairs.
Hi, I'm Peter Parks. I represent the Overlook Houseless Outreach Committee. We are associated with Hazelnut Grove as one of our programs that we help. We're helping them currently to move to the St. John's area and are helped by the joint office. We also work with homeless people who are camped in our area. There's a number of people that you would not notice who are camped near the Adidas headquarters in what is called Madrona Park. It's an unimproved park. Those people have just been swept, and I use that term and not the term that the city likes to use, which is clean, because they don't actually clean. They get rid of the people and they don't really clean the area. I'd like to talk about the budget of the Homelessness Urban Camping Impact Reduction Program, specifically as one example, where the auditor recently said that the budget for that is $3.6 million a year. If that money were used instead of sweeping people to provide trash pickup, to provide porta potties, to provide water for people, and if there was actually sanctioned camping, and I know that SOS is working on doing that, we've been involved with that. It is very frustrating to work with these city committees to try and get something done. They talk a lot about policy and don't get things done. People in the Hazelnut Grove are actually organizing a walk to Salem to raise up the issue of homelessness. They're asking for attainable housing, not affordable housing, attainable housing, that we stop the sweeps, that we allow sanctioned camping with, as I said, restrooms, trash collection, and water. So hopefully we can consider those things when you consider the budget. Thank you.
Thank you.
Good morning. My name is Jorge Devendorf. I work with Transition Projects. And a brief message of gratitude. Last week I was in Washington, D.C. for a national forum of affordable housing advocates and practitioners. As you can imagine, in that kind of forum, there's a lot of discussion about what makes our respective challenges different from one city to the next. What makes Portland different, it was clear to me in commiserating with my peers, is not that we have a homelessness crisis, it's that we have political leadership at the city and the county level that is willing to make tough choices to address this critical issue. We also have a votership that has repeatedly stepped forward and said, we are willing to make sacrifices to try to address this civic issue. So I think what we've heard this morning is what I know to be true, and that is we have a system that is still imperfect and is still insufficient, but nevertheless is built upon nationally recognized best practice and that embraces tools, resources, and approaches that we know work. Over the last 3 years, thanks to your leadership, we've built a system that's helping more people more deeply than ever before. And simply put, now is not the time for us to take our foot off the gas. Thank you for your continued leadership.
Thank you.
Thank you. Hello, I'm Nathaniel Wright. I'm somebody with lived experience with homelessness. I'm also Native American from the Klamath tribes. I was asked to speak today by my housing specialist, and I'd like to also take the time to thank NARA, thank Central City Concern, and thank the Hope Housing Grant. You know, I think that name really suits them because for me, that's one thing that they've restored for me was hope, you know. I was able to obtain my own home for my daughter and I. I am a single parent in recovery, and just things have really been looking really good for us, you know, success-wise. You know, I'm able to do things like give back to my community. You know, I'm somebody who does things like H&I, which is hospitals and institutions, taking well-variety meetings into facilities, being able to care for my home and work. And I just really want to give back, you know, so I became certified as intentional peer support for those who are suffering from like mental illnesses and addiction and things like that. So once again, just thank all of you, you know, for doing what you do and making things possible for people like me and for my children. That's all I got. Thanks.
Thank you.
Hello. Hi, I'm Samantha Garcia, and I received a HUD grant in March of last year, and I've had it for I'm still a part of it, and I was homeless for 2.5 years. And I just wanted to say it really helped me. I'm enrolled in school now, and I'm off drugs, and I got a car and my driver's license, and I just wanted to say that it really does help the homeless community. So thanks.
Thank you. Our next four numbers, again, 1226, 890, 890, 916, 916, 919, 919, and 889, 889.
Oh, okay, thanks. Good afternoon, Mayor and Commissioners. My name is Margot Black from Portland Tenants United, which is a registered lobby group. I want to first just say this has been a really informative presentation and session. I really appreciate all the slides, and I've learned a lot. So thank you for having this. I just have very brief remarks, and that is that what Katrina spoke to in her presentation, I want to underline everything there, that supporting tenant protections either through legislative ordinances or by investing in services in the in Portland Housing Bureau is preventative and very meaningful and impactful for those who have not yet become homeless and are trying to keep roofs over their heads. As a member of the Rental Services Commission, I'm really encouraged to see us move towards the landlord registration program, and I think that will be really helpful. But apart from that, I have to say that I've been pretty disappointed in the Bureau and the city's investment in the Rental Services Office and providing services that were part of your platform, Mayor. When you were running, I just want to read to you that you said that you were going to create an Office of Landlord-Tenant Affairs within the Portland Housing Bureau to mediate disputes between tenants and landlords. The office would inform landlords and renters of their rights and responsibilities, including a clear and consistent set of standards for landlords. By the way, screening criteria would get us there. Well, not all the way, but be very close. The office would be funded by shifting existing resources within the Housing Bureau or through fees paid by the industry the office regulates. From where I sit at the Rental Services Commission and as a tenant advocate, that office does not exist yet. I know that there is something called the Rental Services Office. It was earlier referred to as the Renter Services Office. And that, to the best of my knowledge, pays out money to contractors in the community that are doing amazing work, but it is still not something that a tenant can walk into it and get any of these services provided. The staff that have been hired to help landlords figure out if they are exempt from relocation. And I just think that says a lot about what where the priorities are. The fact that the screening criteria ordinance would be $500,000 this year and $400,000 in the ongoing. I just have to say that to me that feels like such a drop in the bucket in terms of money for the huge impact that it would make. So please invest in these services and prioritize them and take them seriously because they are really meaningful and I feel like promises have been made that have not yet been kept.
Very good. If I could respond to that, please. First of all, there is an office. People can walk in. They can get many, but not all of the services that you described. And it's not a drop in the bucket. As you saw in the very first slide, we have $1.7 million of additional resources for ongoing programs for all of the bureaus in the city of Portland. But what I am hearing you say is that this is a top priority for you to fully build out the Rental Services Office. Is that correct?
I mean, I think it should be a top priority, yes.
Great. We're in agreement.
Great.
Hello. Thank you. Thank you, Mayor. Thank you, Commissioners. My name is Paul Soucy. I'm a manager for Transition Projects. I manage the Walnut Park Shelter, which is located just down the street on MLK in Killingsworth. It is an 80-bed shelter, low-barrier shelter for men, women, and couples. And we opened the Monday before Thanksgiving, and we were at full capacity by Thanksgiving, and I turned people away every night. And I just wanted to tell you about a guy I'm going to call Jerry, who had been homeless for 20 years and experiencing developmental disabilities and addictions and spiritual struggles, and tended to hit himself very violently and get excluded from all other services as a result. And I'm very proud to say that because we were there to, provide a place for him to sleep every night and contact his case managers for him, we were able to get him into housing in just 3 weeks ago. And for the first time in 20 years, case managers who had never spoken to each other, police officers who had been looking out for him, Providence, halfway houses, they were able to talk to each other because we were able to make phone calls for him. And so and find housing for him. And that's what our shelters can do. So as much as we can, thank you so much for all that you have done historically to make my program possible and for all that you continue to do to make other programs possible. Thank you.
Thank you. And you're the one who makes it successful, so the thank you is really to you. Thank you.
Hi, my name is Diane Moffa. I'm a senior who lives in the North Portland area. I am I have a head injury. I am a disabled senior. However, I did manage to work most of my life. I understand homelessness from the inside. I've been homeless twice. However, there is something called social responsibility and accountability, and you have to also put in your part. So while I was homeless, I did community service work. I helped out the people who were helping me. We have a huge amount of labor available to us. We can't cut parks and peacekeeper services to fund housing when we have a huge labor pool at our fingertips. We had a housing or a works program in the 30s, the 1930s, and it worked really well. It built a road through the gorge. There's all kinds of things that could be happening. We're offering free services that people across the country are coming to take advantage of. I get asked for money while I'm working in my yard constantly by people from across the country. New Orleans, Texas, Florida, Chicago, you name it, they're coming. I've also been threatened by locals in my neighborhood with beer bottles being put through my eye if I make any trouble for them, if I can't give them what they want. This kind of thing just can't take place in a city this big anymore. There has to be there have to be rules and accountability when you have a population this size living in a small area. You can't just like freewheel it anymore. It was nice years ago, but it doesn't work now. So I'm, trying to figure out, how do we address this problem? Part of it is the fact that we have commoditized housing, and it is now an investment opportunity and not shelter. It was never meant to make money. It was meant to put a roof over our heads.
Thank you.
Thank you. The last three lottery tickets, 1226, 917, 917, 918, 918, and 915, 915.
Hi, my name is Beth Staus. I'm a resident of North Portland. I have two different notes here. I'm going to try to go quickly. I'm here today on behalf of my neighbors that could not be here. I want to express my strong opposition to the proposed closure of Columbia Pool. I'm very happy to see you here. Mr. Fish, Mayor, Commissioner, thank you. The pool is a vital resource for our community.
This is a housing forum and not a park.
It's a public testimony.
Just let her.
It is open. I made sure that I could come and speak. Columbia Pool supports all people of North Portland. It is a vital resource in our community, serving thousands of children, families, seniors, and the homeless. Columbia Pool supports aquatic programs in our city's most underserved schools and is a crucial resource for many underserved populations in the community. My children go to swim classes at Columbia Pool. I get up at 5:30 in the morning, no, actually 5:20, and I get up, I've already picked my classes, I have them saved in the queue. I get my computer, I click, push into cart, and sometimes I don't get the classes that I want. I've planned ahead. I have a computer, I have a credit card. I can do it, but there aren't enough swim classes. So if there aren't enough swim classes for the kids who want to take swim classes, and then we close the only indoor pool in our community, what's going to happen? Every summer I hear of children drowning in the rivers, and without swim classes, we're going to have more drownings. I understand we have a budget shortfall, and I support all the things that were talked about at the meeting on April 2nd and the things that are discussed here today. I want everything to be supported. I don't want to pit parks against housing. I don't want to pit Selwood against North Portland. We have more people in this community. I pay more tax dollars. We should have more services. But ultimately, if there needs to be a pool in North Portland, if you choose to close Columbia Pool, it's going to have a very high impact on a lot of families and seniors. Please support keeping Columbia Pool open until there is another pool in our neighborhood. Thank you.
Can I respond briefly? And I apologize for being rude. I was not aware that we were opening it up. Good for you for being here to talk about Columbia Pool. I was not able to be at the last forum because I was in recovery for my treatment. And I want to, if I could, Mayor, just take 1 minute on the pool, because I think you have a right to hear from the commissioner in charge on the issues you raise. First of all, I want to be very clear. There are no cuts in the package that we brought forward that I like. We were required as part of the budget rules to come forward with a balanced budget. That's the rules we all subscribe to. And so you can imagine, how do you choose between adaptive and inclusive programs, which we've protected, programs for people with disabilities, which we've protected, all of our outdoor pools, which we've protected, and where then do you find the cuts that you need to show a $6.3 million gap closure? So one of the reasons that Columbia Pool was selected, and I'm not saying this to defend the position, I admire your advocacy, and I actually think we're going to be able to work together on a better solution. But one of the reasons it was selected is it meets a couple of our filters. One is it has over $2 million of deferred maintenance. As you know, the city is struggling to come up with those maintenance dollars. You know, we have people who say to Chloe, if we have $1, put it in a pothole, or make streets safer at 122nd, or whatever. So we have $2 million of deferred maintenance, plus we have a big gap in the cost of running the facility. That is, the money we get in and the cost of running it produces a big gap. Now, what you should know is that in the budget that I've presented, and I don't love the budget. I'm not here to say that I would like to see all these cuts. We have asked for one-time money to delay the closure for 1 year. I think you know that.
Yes.
And my office, through my team, has signaled to a lot of the advocates that we want to look to a pivot that gives us a better solution long term. And one of the things that we want to talk to the community about is it time to build out an aquatic center at Charles Jordan Community Center? Now you're going to say to me, Nick, if you're closing one and talking about building another, how do you reconcile those two? It's because I have something called systems development charge revenue that I can only spend on expanding our system, which would allow us at some point to have a full service system at Charles Jordan and to have a state-of-the-art aquatics facility that would be less cost to maintain. So here's my commitment to you. Please support this part of my budget where I've asked the mayor and my colleagues to support 1 year of continued funding, because that's in my request, so that there would be no interruption of services for a year. Please then come to the table with all the good ideas you have about what the alternatives are. And please consider whether Charles Jordan is part of the long-term solution to having an aquatic center that we can afford and properly maintain. And I appreciate you being here, and I commit to you to work to find a solution.
I work with a group called Friends of Columbia Pool, and we would love to work with you. There are a lot of people in the North Portland community who just want to keep Columbia Pool open, but there are a whole lot of people who are committed to there being an indoor pool in North Portland.
Yeah.
The thing is, we just don't want to lose swimming lessons and programs for seniors. And when you talk about adaptive and inclusive programs, a pool is that.
No, I understand, but we have a specific program for people with intellectual disabilities, which for the first time we'll protect. Here's my commitment again. If you'll give me your support for that additional funding for that 1 year bridge, we'll be at the table with you looking at a long-term solution.
I think that's a possibility if we can have something more firmed up about Columbia Pool, because as I have not.
You're a good advocate, and fair enough.
Thank you.
Thank you.
Good morning, and thank you for giving up a part of your Saturday to be here and allow for this public forum. My name is Susan Bladholm, and I'm the founder of Friends of Frog Ferry. Our goal is to research the potential to bring a public passenger ferry service to the region. In PBOT's new strategic vision, Moving to the Future, it outlines the following goals, which we would help accomplish: reduce congestion, resilience planning and safety, equity and community livability, clean air and water, and economic vitality. Why isn't determining the viability of a passenger ferry service in PBOT's plan and $600 million budget? Every major river city in our nation has some sort of ferry service, except for Portland, and most are investing more in growing their services. We are a grassroots effort of more than 800 supporters and stakeholders, 80 pro bono industry experts, including those out of the San Francisco and Seattle ferry services. And we understand the need to look through the lens of affordability, equity, and access to more transit options. In essence, we would be connecting the workforce to employment centers. For the past 2 years, we have made several funding requests to the city, and to date, we have $50,000 committed, and we thank you for that, Commissioner Udaley. I was here before you a year ago, and funding has popped in and out of budgets. We need a stronger signal from you, our civic leaders, to let our local, state, and federal funding sources know of your support, and ask that you commit $250,000 into next year's budget. That could be out of PBOT or special appropriations to support our feasibility studies and the finance plan. That's $250,000 of $1.3 million total, which we're getting from other sources. Research shows that transit is the #2 issue to our citizens in our city. People want new modes of higher capacity transit. At no cost to the city or taxpayers, and with no new FTE, we have already delivered over $500,000 in value. We ask for you to signal the city's support and help fund this bold initiative. It's time for visionary leadership as we anticipate Portland's future. Thank you.
Thank you.
Thank you. This concludes the open testimony that we have asked for. However, there are a lot of other ways that you can also give testimony. Again, online testimony submission, comment cards that look like this. Please fill one of these out. Fill one of these out no matter what, because it also helps us with other information, but also any additional comments you might want to make. Share your thoughts with the community and the city leaders on the sticky notes right out front, or you can also tweet to CBO at #PDXBudget. What comes next? Next steps. The mayor's proposed budget will be released in early May. On April 9th, there is another community work session on parks, recreation, and open spaces, and it will be at David Douglas High School in the North Cafeteria. You're also welcome to watch and listen in person or online. The event will be live streamed. Another possibility, you can give testimony on the mayor's proposed budget online or in person on May 9th at the public hearing on the mayor's proposed budget. Again, testimony, comment cards, online testimony, all of it will be provided to the to council offices. Again, thank you so much for being part of our community, for taking time on a Saturday morning to come and to share your thoughts and opinions. Thank you again.
Everybody. Thank you. Appreciate it. Thank you.